So because management of care have the most question on the exam, true, but it's the area that you can easily answer. You don't need any too much critical thinking in this area. Because now the NCLEX want to test you on advanced directive. The NCLEX want to test you on delegation. The NCLEX want to test you how to manage workload, advocate, plan of care, client right and responsibility, uh, team members, conflict, confidentiality and privacy, handoff reports, right? Terminology wide documentation, documenting, that's documentation, transfer, prioritization, ethical dilemma, code of ethics, consent, client, healthcare provider order, utilize resources to promote health, recognizing limitation, mandatory reports, legal scope of practice, performance improvement project, referral. So now let's talk about this, right, real quick. So let's talk about this. I'm going to send you the recording, but as well, I want you to take note of what I'm saying as well, so that you will learn twice. Now, what do you understand by advanced directive? Advanced directive is we have three types, right? Advanced directive is for patients that are not now. Okay, how do I say it? Advanced directive, anybody can have an advanced directive, but advanced directive will be used only when the particular person cannot make decision for themselves. Do you understand? Do you understand?
Yes.
Great. Advanced directive, anybody can have advanced directive, right? But when we use advanced directive is when the patient cannot make decisions for themselves. Now, NCLEX might test you on who is going to be benefiting from advanced directive, right? NCLEX can test you on that and ask you which of the following patients will benefit from advanced directive. So you will just select your answer which patient will be benefiting, most especially patient that maybe their their condition is very critical in a sense that they might be unable to make uh decision for themselves, most especially patient that is having neurological issue, right? So that's big thing. Now, understanding advanced directive, we have three type. We have living will, we have durable power of Anthony or healthcare prosy, and then we have the DNR or DNI. Do not resuscitate, do not intubate. Now, for advanced directive, we do something during admission, between care, right? And any other thing we do. Right, during admission, there's two things the nurse can do. Is it that the nurse will decide to ask to find out if the patient have advanced directive or not. Now, if the patient don't have advanced directive, take note, the nurse don't obtain advanced directive. Take note of what I said. The nurse don't obtain advanced directive. The nurse will go report to the doctor about that situation, that the patient don't have what? Advanced directive. So it's the doctor that will obtain the advanced directive. Right. The doctor will obtain the advanced directive. Yes, situation might happen that we might witness the advanced directive, but we don't notarize the advanced directive. The legal team are going to do that. Even the doctor don't notarize. Right. The doctor don't notarize. For advance directive, there's no need to observe the patient signing the advance directive. No. If it is for informed consent, yes, we witness the patient signing the advance directive. Sorry, the informed consent, but for advance directive, it's not necessary, it's not important, right? For advance directive, that's one thing you need to know, right? But the key thing I just want you to know is that we don't obtain, as a nurse, we don't obtain the advance directive. If a patient don't have advance directive, we tell the doctor will come do that, right? So now let us say the patient have advance directive, right? For a patient that have advance directive, what we do is to get the advance directive from the client. When we get the advance directive from the client, we teach back the advance directive to the patient to be sure that they still maintain what they have written in that advance directive. It's the client right. So now the client might not say, yes, that is what I want. The client might say, no, I'm changing my mind. Now, if they say they are changing their mind, yes, initiate the change for them. Tell the doctor about the changes so that uh it can be changed. Advanced directive can be changed, right? So that's one thing you need to know. Yes, they can make changes to the advanced directive. It's the client right. And the previous one need to be discarded. Right. So and the new one you need to like document it. Now, let us not say, okay, the patient say, oh, I'm not making change. I like what is on my advanced directive. That is what I want. Now, what you want to do with the advanced directive is to do two things to the advanced directive. You want to document it, right, in the medical record where other staff member can see it. And also, you want to uh, tell the team member, the healthcare members about the advanced directive. Not only you are documenting it, you're also informing everybody about it. Because it's not enough to just document it. Some people might not even take note of it. But you want to make sure you tell so that even if people are missing out, not seeing it while you've documented it, they are not missing out on not hearing it from you that yes, this patient have what? Advanced directive. Very important. So that's the two most important thing about advanced directive, right? So now you need to now understand your DNR, your DNI, living will, power of attorney, or healthcare proxy. Now, living will is a written information about what the patient wants and what they don't want. Now, take note, let's go back a bit. Now, when we talk about advanced directive is just a term. What is in the advanced directive is the instruction. I repeat, advanced directive is just a term. What is in the advanced directive is the instruction. So now if the NCLEX just say a patient have advanced directive, that is just a term. It's not telling you what is in the advanced directive as at yet. It's until the NCLEX tell you a patient have advanced directive that said don't do this, do that. That's when you now start acting on the information on the advanced directive. But if the NCLEX don't give you information on the advanced directive, what are you acting on? What are you acting on? Right? So you need to take note of that. Now, living will is a written instruction. Durable power of attorney or healthcare proxy is someone assigned to make to like tell you things about the patient, what they want and what they don't want, right? Making decision for the patient. Now, the do not resuscitate is that they don't want anything like resuscitation, and then the do not intubate is that they don't want anything like intubation. Right, that is what you need to know for that aspect. Now, when there is a living will, Everybody must respect that living will. When there's a living will, everybody must respect that living will, including the durable power of attorney, the staff member, the doctor, the nurses, anybody. They must respect that living will. Right. So the durable power of attorney might say, no, I want resuscitation. And the client living will is saying they don't want resuscitation. You only follow what is in the living will, because we expect the durable power of attorney or healthcare proxy to respect what is also in the living will. The durable power of attorney is supposed to be saying we should not do anything outside the living will, not saying anything different from the living will. Same way as the nurse want to respect the living will. Right. But if we don't have a living will and then we just have the durable power of Anthony or the healthcare proxy, okay, great. Then we can take instruction from uh the durable power of Anthony as a nurse or the healthcare proxy as a nurse. Right. As a nurse, we always want to advocate for what the client wants, be it they have it on the living will, or if there's no living will, we take what information from the healthcare proxy and we advocate for that. So if there's any kind of conflict situation that is somebody is saying, oh, I want you to resuscitate the patient, and then the living will of this patient is saying no resuscitation, we tell them that it's your duty to follow the instruction or the living will's instruction of the patient. That's your duty as a nurse. You are going to tell anybody that is telling you not to follow it, even if it's the doctor. You tell them, doctor, the patient have a living will not to do this and that, and you follow what's on the living will. You have always advocate. But in situation whereby you try as much as possible to advocate and it's causing furthermore problem, ethical dilemma, then you report that situation to the ethical team. That's what you do. You report that situation to the ethical team. It's very important that in the decision making of the client during the process of the initiation of advance directive, you need to involve the client family, their loved one in the decision making so that we can minimize ethical dilemma. It's very important. Always involve the family member throughout your NCLEX exam. If your NCLEX exam is telling you something about involving the family member, always involve the family member. Always. It's very important. We don't restrict client from family member. That is one of the big client rights. Right? If there's decision to be made about the client, maybe client plan of care, you always want to involve the their family member if the NCLEX asks you to involve. So that is everything about advanced directive. Any question, please?
That's understand.
All right. So now, if they give you any question on advanced directive, I believe you'll be able to answer that correctly. So yes, now advanced directive delegation
I
for to
have a
del.
quick sorry.
Hmm?
I have
What
a
is it?
quick So, with Evans directly, let's say, because I'm just thinking about this, and I think I came across a question that said they were doing the in the middle of do not a patient family member was there in the middle of a code,
Okay.
and they didn't know that this patient have this in place. So I struggle on getting that answer right. Like, do you stop that to inform the family member that this is what in the patient will, or do you just continue?
All right. Let me try to understand your question. You said they were in the middle of
Of a call, and this patient family member was trying to stop it.
okay, the patient family member was trying to stop it. The
Yes.
family member was saying they have advanced directive that indicate them not to do resuscitation.
They were not aware of it.
Okay, the staff member were not aware of it.
The family member was not aware of it. So in the process, in the middle of this call, do you stop that to explain to the family member, or you just proceed with what is in the will of do
All
not
right.
receive?
This is it. Now, this is the thing. There must be an advance directive that the staff member who are performing the code should follow.
Yeah.
So if the family member is saying they should stop the code, that's what I'm asking you now. Is that question saying the patient have advance directive not to be resuscitated?
Yes.
So what you are trying to say is that it's the staff member that don't know that the patient have an advance directive of not to be resuscitated.
The staff member is aware of it, and that's what they are doing. But family member. So in that situation, that do you still continue, or you just take it straight to the ethical
Where did
committee?
where did you get that question from?
I think it was probably one of the tests when I was doing
Exam.
my thing. Yeah.
Maybe you are the one that you are not saying the question right. Let me explain what you are saying. Now, this is the scenario you are trying to paint, right? Because it's the duty of the staff member to know whether a patient have advanced directive or not. So the NCLEX will tell you that the staff member know. Now, this is what you are explaining to me. You said they were in the middle of a code and they were doing resuscitation for the patient. So if they were in the middle of a code and they were doing resuscitation, it means that the staff member already know that this patient want to be resuscitated. The advance directive is not saying they should not be resuscitated. That is what this means.
Yeah.
Right. Now you now said the family member now came in and they said they should stop it.
Yes.
So now that's what I'm asking you. Initially, is that question did that question tell you that this patient have an advance directive that said do not resuscitate?
Yes.
So they said they should not. So why is the staff member not doing code for them? For the so why is the
No.
staff member doing
The
code?
patient, yeah, the patient have, I think I'm confusing this question. The
Mm,
patient have do not, the patient, it had DNR, yes. The patient have DNR, do not resuscitate.
yeah. So why
That's
is the staff member now resuscitating? That's the thing. But if maybe I'm not really understanding the question well, let us say the do not resuscitate was not known to the staff member, and the family member asked you to stop it, and truly, there was a do not resuscitate, then your correct answer is to stop it.
stop it. Okay.
Yeah, because they have do not resuscitate. You need to stop it. So even if it has started already, you need to stop it. If not, it could become a very legal case and then cause serious problem. Right, it need to be stopped. So because that is what the client wants, because it's there,
Yeah.
right? Do not resuscitate. Any other question?
No, that's it.
All right, great. Don't worry. When I send you some question on advanced directive, you'll be able to pick up on some knowledge. Now, delegation on the NCLEX exam, NCLEX tests two type of delegation, right? We have assign and best direction. When you are talking about assign, NCLEX wants you to think about the task and if the patient is what? Stable. But when you're talking about best direction, NCLEX wants to make sure that the statement made include the patient condition, the tasks that need to be carried out, and the tasks, right, should not be vague. It should be specific. The task should not be vague, it should be specific. It's just like now, if the NCLEX say activity of daily living, this is vague. But if the NCLEX say bathing, this is specific. If the NCLEX say dressing, this is specific. But ADL is vague. So NCLEX don't want vague tags. Right. So yes, that is that for delegation. You need to know the tax. The tax must be you must be able to delegate that task based on the scope of practice of the member you are delegating it to. Most especially, NCLEX always use UAP, right? So UAP, you must be able to delegate to them the task. It must fall within their scope of practice, right? So you need to know the scope of practice of the UAP, the registered nurse, and as well to the LPN. Is that clear?
Mm-hmm.
All right, great. Now, when the NCLEX is testing you on organizing workload is just trying to create a balance in a way whereby if you decide to start something now, you know where to end it, right? So, organizing workload, one thing is to be able to prioritize based on timing, or you are delegating tasks. So you prioritize your tasks, you based on timing as well too, and you're able to delegate. You make plan for the day. Another thing is to make plan for the day. You are prioritizing what is important and what is not important. You do what is important now, leave what is not important later. So that's what it's all about, organizing workload. You are just trying to do things to make sure that everything is going on fine. Advocating is a big thing that you need to know, right? As a nurse, you need to advocate. Anytime either the doctor, anything is going wrong with the patient, you want to advocate. So that is something we hear a lot in nursing school. Advocate, advocate. Anytime something is wrong, it's our duty to advocate. So if you see any answer related to advocating, select it is correct. Now, plan of care, right? When we are trying to create plan of care, we are trying to talk about what? Intervention. What is the best intervention for the client? Now, so when the NCLEX is telling you about intervention means that we are thinking about different problem that the patient might be experiencing, and what can we do to either avoid the problem or take care of the problem. So if the NCLEX tell you about COPD, all you just need to do is to look at the answer keys and find out the problem. Right. Because you are not thinking about anything in that question. Instead, you are focusing on uh what is the problem that the NCLEX is talking about. Now, the first option might tell you an issue with fluid. You are not thinking about anything. All right, let me show you an example so that you can be able to understand what I'm saying. Let me show you plan of care. All right, now this is a plan of care question. Right here. You can see my screen, right?
Yeah.
All right, pay attention. This is a plan of care question. You can see it, plan of care about moderate Alzheimer's disease. Now, the mistake a lot of students do is to start thinking about a lot of things. The NCLEX is not asking you to think about a lot of things because the NCLEX will ask you for intervention. All you just need to do is to come to the answer keys and find out what is the problem of the patient. Because intervention, you are trying to solve a problem. Now, if you read this option, you'll be able to find out that the problem of this patient is an issue with memory. If you read this option, you're going to find out that the problem of this patient is an issue with agitation, right? Or let us say the inappropriate behavior. Right? If you read this option, you'll find out that the problem of this patient is reversing their AD, their Alzheimer's disease. Now, if you read this option, you'll find out that the problem of this patient is is giving them the ability to plan for themselves, right? Now, this is a problem: memory, agitation, reversing the AD, planning for themselves. Now, what we now want to find out is that intervention, we are trying to give them, when we are talking about intervention, we are trying to give them the solution to the problem. That is what we do when we are talking about intervention. So now you're not going to now find out what solution are we giving to this patient. Now, for this patient that have memory issue, we are giving them this solution for them to reminisce. For this patient that have agitation and inappropriate behavior, we are giving them what? This solution. We are using this solution to solve that. For the patient that want to reverse their AD, we are using the solution to solve that. For the patient that want plan of the day, we are giving them the information. Now, for care, right? When we are trying to answer intervention question, at least your answers should be related to what is going on based on three things: pathophysiology, body, body system that is affected, right? Pathophysiology, body system that is affected. Okay, no. The third one is for when you are doing prioritization. But when you are doing plan of care, you just need pathophysiology and body system that is affected. Right. So if in case maybe you don't know what this disease is all about, you can easily look at your answer keys and be able to find out what it's all about. Now, and you know what it's all about based on the body system, right? Now, memory is related to what body system? Neuro. Agitation is related to what body system? Neuro. I just only need two options to tell me about the body system. Then I can easily believe that this body system, this condition is related to neuro. So I'm looking for care related to what? Neuro. Now, memory is the issue here. Reminiscing, this is a good technique. Agitation is the issue here. Confronting, this is a bad techniques. AD is the problem here. Using this medication, I need to ask myself, are we dealing with chronic congestion? Because now, anytime you want to use medication for a patient, medication will only help acute problem. Medication cannot help chronic problem. Because for a chronic issue, right, there's no medication cannot solve the damage that has been caused. But for a acute issue, medication can solve it. But if you look at this condition, right? This condition is a chronic issue, right?
Yeah.
This condition is a chronic issue. So since it's a chronic issue, we don't expect medication to solve it. You understand? Now, the other one is talking about plan of the day. Now, for uh, you to be able to plan, you need to know the kind of patient you are dealing with, right? Because the patient needs plan of the day, but can they plan for themselves? That is the question. Most neurological patients cannot plan for themselves. So this will be out. If maybe we are dealing with a cardiovascular issue, we are dealing with respiratory issue, yes, maybe they can be able to plan for themselves. But with neurological system problem, their thinking process might be having issues. So we cannot really say if they can plan for themselves since this is a neurological condition. So this will be out, and then we are left with number one as the answer. Do you understand the concept?
Yeah.
Yes, so that is it. The kind of care we give or the kind of intervention we give is related to the what? The pathophysiology of the condition and is related to the body system affected. That is the kind of intervention. That's why I wish to tell students instead of learning disease condition, go and learn how to care for each body system. Go and learn the kind of care you give to a neurological patient. Go and learn the kind of care you give to like cardiovascular, respiratory. That is what the NCLEX wants you to know. Because the NCLEX know that there's 50% chance of knowing this condition. So if you don't know the condition, you can still answer the question if you know the kind of care that is given. You understand? Do you understand me?
Yes, yes.
All right, great. So that's what the NCLEX is all about. That's for plan of care. Uh, Now, the client right and responsibility. Tell me the client right and responsibility.
Respecting their privacy,
Yes, that is one right to privacy. Tell me more.
right? Care.
What do you think?
No, as a right to care and I think
Yes, they have right to care, right to refuse medication, right to change anything in their medical record anytime, any day without no restriction. You understand? Right to teaching. right to confidentiality. All these things are the client right. Their responsibility. They must be able to listen to the staff member, respect the staff member, right? Follow their medication. They should be able to take their medication as prescribed, right? Follow treatment plan. These are their responsibilities. So that's what the NCLEX just want you to know when it comes to client right and responsibility. So that's that. So that's all those client rights that we mentioned and their needs that we mentioned. If you notice that anybody is violating it, you advocate for their right. And if you notice that, oh, they are not getting what they need to get based on their right, you advocate. That's what the NCLEX is just trying to talk about when it comes to advocating. Now, multidisciplinary team member. What you need to know there is all the team member, right? And the reason why you want to know all the team member here is because of the reason why you want to know the team member here is because of situation like this, referral. Situation for referral. Because the NCLEX might tell you, oh, a patient is having difficulty managing their condition at home. Who will be the right person to refer them to? That's the social worker. Now, the NCLEX might say, oh, a patient is having difficulty with nutrition, maybe diet, or they don't know how to manage their low sodium diet. Who are you going to refer them to? Either the dietitian or the nutritionist. Yeah, a patient is having issue with muscle, right? Who do you refer them to? The physical therapist. The patient is having issue with activity of daily living. Who do you refer them to? Occupational therapist. A patient is having difficulty with talking or recent stroke. Who do you refer them to? Speech therapist. If they have slow speech difficulty swallowing or swallowing test, speech therapist. There are those people that solve something like that, right? That's the reason why you need to know the team members, right? So that you can be able to find out, like maybe answer question according to referral. So that's why you need to know that. Now, conflict, in order to manage conflict, you can use something like this to manage conflict, your assessment, diagnosis, planning, intervention, evaluation. In a sense that you want to know what is going on. That is the first hitting in managing conflict. You want to know what is going on. So that is your assessment. Then when you now know what is going on, you can easily now that's your diagnosis. You now know what is going on. You can easily now plan, and then you can easily intervene and then evaluate what is going on. Now, when it comes to conflict, right? You don't solve conflict without each party, right? Party might be the charge nurse and other staff members. The two of you have to come together to solve the conflict. Only you cannot fix the conflict. Two people have to come together. So that's the reason why for conflict questions on the NCLEX exam, you need to know what's the situation, what's going on, why they are making that plan, what you are trying to intervene, and the result. Let me see if there's any conflict question here. Let me see if there's any conflict question so that we can go through it. I guess there's one, but let me see. Okay, there's conflict question here. All right, so let us see through what I said. Now, this is a conflict question. So they said the nurse is planning a staff education program about collaborative conflict resolution strategy. Now, we are not only trying to solve conflict, we are trying to collaborate. I just said it recently that when you are trying to resolve conflict, you don't do it only by yourself, you do it with the both parties. It might be you and another member or two different other people. So it's collaborative now. which of the following would best describe implementation? And you saw what I said. Conflict start with assessment, diagnosis, planning, implementation, and evaluation. So now the assessment has been done based on that conflict. The finding the problem has been done. The planning has been done. Now we want to intervene. Now, in order to intervene, at least we can easily know what is going on right here. Right? Collaborative again, conflict resolution strategy. Now, collaborative. Now, any option that is not related to collaborative, you can easily eliminate that. So that's what I will pretty much do first. So a staff nurse is working with the nurse manager. This is collaborative, but we don't even know whether it's a complete one yet. So let us keep that. Now, the clinical nurse leader is flattered by being asked to help create a clinical ladder for nursing staff. This is not collaborative because she's only doing it herself. That's out. The charge nurse is working with staff nurses. This is collaborative. Now, a new nurse has been offered to work on holiday in exchange. This is not collaborative, so this is out. So now you are left with two answers that are collaborative. A nurse working with somebody, this make them collaborative. Other statement might be used, but in this question, that's it. Now, the NCLEX is not looking for just collaborative, but they are looking for best describe. That's the keyword, because the NCLEX know maybe there's possibility you might see to collaborate, but best describe. Now, let us see if this is best described. So the staff nurse is working with the nurse manager and offering suggestion about upcoming new procedure. Right. The staff nurse is working and offering. So I feel like the staff nurse is only offering, and maybe the two of them are not bringing the suggestion together. Because I feel like, oh, maybe the staff nurse should bring suggestion, and then the nurse manager as well too should bring their own two suggestions. Let's see number 3 first. Now, the charge nurse is working with the staff member, with the staff nurse and nurse manager. Oh, they are even a lot to develop shared goal. You can see this keyword,
Yes.
shared goal. Look at this one, offering suggestion. It's only one person that is offering suggestion. Most likely the staff nurse is only offering the suggestion. But look at these 3 people. They are coming to do what? Share goal, a plan for new staffing format. So this is more of the correct answer. Do you agree with me?
Oh,
Hmm?
yes, yes.
All right. So you understand the concept now.
Yeah.
Yeah, so it's not difficult, right? So it's most time when we miss out on some certain questions, it's the way we think, right? It's the way we think, or we maybe we just learn by definition. We have not learned by practicing, right? That's what affect a lot of students. We don't learn by definition, we learn by practicing. So we might just say, oh, conflict is the settlement of so. You don't even know what is involved in conflict. And you see a question like that, you find it difficult, you overthink, and you understand. So yeah, that's conflict for you. Now the aspect of confidentiality and privacy. Now, for this, we use the HIPAA law, right? The HIPAA law. Confidentiality always used to have issue with this mandatory report. They always used to have issue with each other. Now, when you are trying to keep things confidential, by law, there are some things that you don't keep confidential. When you are trying to keep a lot of things confidential, by law, there are some things you don't keep confidential. Yes, I know I need to keep 1, 2, 3, 4, 5 confidential. But by law might say, I want you to keep 1 to 5 confidential, but number 3 should not be kept confidential. So if a patient come with number 1, come with number 2, come with number 4, number 5, yes, I can keep this confidential. But if I see a patient coming with number 3, then I will not keep that confidential, because by law, it says I should not keep number 3 confidential. Right. Now, a patient might maybe a new mother who newly gave birth to a child, and then somebody visited the unit and claimed to be the friend, right? and they are trying to find out information about this new mother. It's the duty as a nurse to keep the information about this new mother confidential, even if the person is claiming to be a friend. You can do two things. You can either tell the friend to call the mother to see if they want to really see the friend, or you go tell the mother about the situation to see if they want to see the friend. But don't give the friend any information as at yet in regards to the new mother, because those are things you need to keep what confidential. But there are things that you are going to see about your client that you don't keep confidential. You don't keep abuse confidential. No. You don't keep communicable disease confidential, such as your TB. No. You report all these things. All these things I'm saying you need to report. Look at what the NCLEX is saying. You need to report them. Stab wound, that is violence. You don't keep it confidential. Gunshot wound, you don't keep it confidential. HIV, you don't keep it confidential. Rape, assault, you don't keep it what confidential. All these things, right? The by law you need to report them. Do you understand, please?
Yes, I do.
All right, great. So I've explained two things in one, right? That's confidential, and then um that's confidential and what you should report by law. Now, if you can see now, let us say now they are testing a particular patient for alcohol level. Do you report that or you keep that confidential?
Confidential.
Obviously confidential, because the NCLEX can tell you report the patient's alcohol level to the police officer. Then you might be like, you will be like, oh, the police officer need it. The police officer have right to get anything. No, as a nurse, you have bigger advantage over the police officer. When the police officer come and they say they need the result for the patient they brought in for the alcohol level, you keep it confidential, because by law did not say you should tell that to the police officer. But if it's an issue with maybe abuse, neglect, rape, assault, okay, by law, yes, they ask you to report that. Gunshot wound, stab wound, yes, they ask you to report that. But alcohol level, no. All right, I just said I should test that in. Now, let's talk about hand of reports. Now, there are two types of reports you can do right on the NCLEX exam. This is hand of report about assigned clients. You are doing this to upcoming shift, upcoming what shift or other staff member. That's what we are doing. Now, when the NCLEX is talking about hand of report, the NCLEX is telling you that you have you worked as a nurse before?
In a PCT.
As a nurse, right?
PCT. Yeah, yeah, not yeah.
Okay. And you gave report, right?
Mhm.
All right. While you were giving report, you were telling other staff member about the good side of the patient and also the bad aspect of the patient. I
Yeah.
mean, their condition.
Mhm.
Now you can say, oh, the patient with hypertension this morning, blood pressure was high, but blood pressure after medication throughout the shift, blood pressure was maintained. Right. So the end of shift report is not about what is going wrong with the patient. It's also about what is going right with the patient. Right, because a lot of nursing students feel like you only report what is bad about the patient to upcoming shift. No, that is not end of care report. You report what is good and what is bad. Now, the NCLEX can now ask you for what they want you to report to the upcoming shift. They wait for the NCLEX to now tell you. Is the NCLEX examiner now wanting you to say the bad aspect, or what is going wrong with the patient, or what is going right with the patient? Wait for the examiner to ask you the question. Now, apart from what is going right with the patient and what is going wrong with the patient, the NCLEX also wants you to know what is significant about the patient condition. Now, when the NCLEX is asking you for what is significant about patient condition, what the NCLEX is asking you is that if a patient is having hypertension, right, what would you say in order to tell a staff member that the patient is stable? That's what the NCLEX is trying to tell you. Now, if a patient is having hypertension, for you to tell me that that patient is stable, you have to tell me that their blood pressure is normal. If a patient is having diabetes, for you to tell me that that patient is stable, you need to tell me that their blood glucose level is normal, within range. For a patient that is having any kind of neurological disorder, trauma, injury, you need to tell me that this patient is not having any level of consciousness issue. Then I know the patient is stable. Right? For a patient that is having pneumonia, for you to tell me that the patient is stable is that they don't have infection, because pneumonia is an infection. So you need to tell me this patient do not have any, like their temperature is normal. Do you understand the concept of significance?
Yeah.
All right, great. Let me test you on that, because a lot of students, you know. So let me see. Significance. Oh, there's a lot of significance here. All right, this is significant here. Okay, so this is the significant question. Now look at what the NCLEX is saying right here. They said the nurse is caring for a 3-year-old client who have cerebral concussion, who has been observed overnight in the pediatric unit. Now, which of the following observation would be most significant for the nurse to report to the upcoming shift? So automatically, this is end of shift report. Now, but the NCLEX is asking for most significant. So the NCLEX is not asking you to say the good side or the bad side this time around. The NCLEX is just asking for most significant. Most significant means that what would you say about this patient that is most important to this patient condition? So what you just need to do first is to understand this condition. What body system is affected? Now, this condition is the neuro. So now for a patient to have neurological disorder, what's the most significant of a neurological disorder? Level of consciousness is the most significant thing for neurological disorder. So I'm just going to look for answer that is related to what? Level of consciousness. So tell me, which of the following answer is related to level of consciousness?
Um, two.
2, yes. That's the only answer. This is not related to level of consciousness. This is related to cardiovascular. This is just related to their eye problem.
Temperature.
This is related to neuro, but not related to level of consciousness. Right? Level of consciousness, patient is not alert. This is your level of consciousness. Alert, oriented to place, time, and situation. That's what the NCLEX know as level of consciousness, or your Glasgow coma scale. Right. Anything less than 13 is a problem. Right. So yeah. So right now, alert is good, oriented is good, to place, time, and situation is good. That's the reason why you want to know. Easily aroused, it means that this patient, yes, their alertness is intact. Right, so we are trying to test what level of consciousness. So this is a test for level of consciousness. This is just a test to see if this patient is developing any neurological issue. Right, there are two things that can happen to a patient with neurological issue. It can affect their level of consciousness, or it can affect their functioning, their organ functioning, such as maybe a patient that is having stroke. If there's a part of the brain that is affected, they might have difficulty communicating. Right, that's not a level of consciousness issue, but that's an issue that happen when there's brain damage. Now for the eyes as well too, it might be a neurological issue that is causing maybe the eyes not to function well, but that's not a level of consciousness issue. Right, that is just issue with the brain function and control. Right, so understand the difference between the two. So yes, that is very much correct. So yeah, we are done with the um report. Now since we are done with reports, documenting approved terminology. When you are trying to document, NCLEX will just test you for this, right? NCLEX will just test you on different kind of terminology to see if you know the right terminology to use. So yes, and also NCLEX like documentation, such as maybe filling incident reports, doing what are they calling it? Near miss, participating in near miss, right? Um, incident report, right? Documenting care, they are big things for the NCLEX. NCLEX can just throw anything in regards to that. So yeah, that is that for that. Now, if the NCLEX is testing you for this admit, transfer, discharge. For admit, the NCLEX is going to test you on something in regards to admitting, right? For discharge, NCLEX will test you on teaching or any special instruction the patient needs for discharge. So now it's for the admitting, right? You need to know in general what you do for a patient while admitting a patient, discharge as well too. So when the NCLEX is throwing any question down, you'll be able to answer. It's just like how the NCLEX wants you to know pre-op care, post-op care, and monitoring for complication. That is what the NCLEX just wants you to know. So, but for the transfer is also related to like referral and slightly also related to the team member as well too. But transfer, what the NCLEX mostly test is to another unit, right? So, but there are two reasons why you can transfer a patient. You can either transfer them because you want to give them extra care, or you are transferring them to make bed available. Now, when you are transferring to give extra care, you are transferring unstable patients. But when you are transferring to make bed available, you are transferring what? A stable patient. Know that. When you are transferring to make uh give them extra care, unstable patient. But when you are transferring to make bed available, you are transferring a stable patient. And a stable patient must be stable for what? 24 hours. So watch out for the time that the NCLEX will give you in that question, 24 hours. I must be free from the issue that they have. If it's the patient that have infection before, infection, what is the sign of a patient that will not have infection? Meaning they have no fever or they are afebrile. Any keyword you need to know. So then you know that patient is stable. Or patient that have hypertension before, but now their blood pressure is 110/68. This is a normal blood pressure reading. So the patient is stable. Right. You just use the patient that have diabetes, and now the NCLEX is saying their blood pressure is blood sugar is 76, patient is stable. Right, you just want to know based on their condition what make them stable, and you can be able to select stable patient. Now, if you are transferring patient from one unit to another, you need to know the kind of unit you are transferring them. The patient must be able to be treated in that particular unit. The NCLEX might tell you a patient is experiencing this social condition, which kind of unit will be best for them to be transferred to. So you need to know where you need to transfer the patient, because the emergency unit, right, we accept every kind of patient, but the emergency unit will start distributing the patient to various units. Yeah, they might say, oh, you need to go to the maternity, oh, you surgical, you medical, pediatric, you understand? So yeah, that's how it works. So you need to know the care they need and what unit they will be transferred to. So that is that for admission transfer. Now, what you also need to know right now is prioritization. Now, prioritize the delivery of client care based on acuity, right? That is prioritization. But prioritization, we are going to do that um not in this session. We are going to do that another session. But for prioritization, one thing you need to know is that we don't prioritize based on their diagnosis. We prioritize based on what the patient is experiencing, never prioritize based on their diagnosis. Right, I'm still going to share you more information another video, but not this. Now, reporting ethical dilemma, you can see what the NCLEX wants you to do. When you immediately you recognize ethical dilemma from your question, the NCLEX wants you to report it. So if you see ethical dilemma, just look for the particular answer choice that talk about reporting it. Right. You need to know your code of ethics and be able to practice in the manner of your code of ethics. Once you see a particular situation and it defines, right, a certain code of ethics, you know that will be your correct answer. So that is pretty much straightforward. Consent, right? For consent, the nurse only witness witness it when the patient is having issues. Maybe they are not understanding anything. We don't teach the patient. Instead, we call the doctor to come and teach the patient about what um you understand what the doctor has discussed with the patient, right? Is the duty for the nurse to ask the patient question about what the doctor discussed with the patient. We are not trying to teach them, but we ask them question. That way we can know if the patient understand or not. If the patient is not understanding, we call the doctor to come and teach them. We are not going to allow the patient to go for surgeries. We can decide and tell the doctor, no, doctor, my patient is not going for surgery until my patient understand everything about the procedure. You can see what the NCLEX is saying. Verify the client receive education, right? That's what we always want to do. We want to verify that the client receive education about consent and procedure. So yes, that is that for consent. For consent, don't use any medication until consent form has been signed. Right. We don't obtain consent form, we only witness it being signed. So there's no any procedure, medication that need to be used before the consent has been signed. The only time you might not need client consent is emergency situation, right? When it's an emergency situation, that's only when you don't need the client consent, right? Healthcare provider order, we have different kind of healthcare provider order. But anytime the NCLEX is telling you to clarify a particular order or question a certain order, trust me, it means that the NCLEX is trying to test you on verifying that particular order. Right. When it comes to order, there are common order you need to know that we always use to clarify in healthcare. Right. There are common order we need to clarify. Now we clarify various order based on the body system. Right, we clarify various order based on the body system. If it's the kidney, there are some certain order we are going to clarify. If it is patient using certain medication, there are some certain order we need to clarify. If it is cardiovascular, yes, there's always certain order we use to clarify. If it's the GI issue, there's certain order. Right, maybe same way I want to review prioritization, I'm going to also review some common order we clarify some other times as well too. Now, utilizing resources to promote quality client care. This is what the NCLEX commonly tests, this information technology. Information technology, NCLEX commonly tests that, right? Because that's the way we communicate. And there are always issue with it. So next video as well too, or next class, right? I'm going to talk about that as well too. Recognizing limitation. This is just about yourself. If a particular task is delegated to you and you know you cannot carry it out, if you need help, you know you need help. That is a form of recognizing limitation. Seek for help. If you need change of assignment, tell the charge nurse so that your assignment can be changed. And if you need supervision, request for supervision. That is about recognizing limitation of self, and also do that to others as well too. Recognize limitation for others as well too when they need help. And you can also utilize resources. Hospital wishes to have manuals towards certain procedure that you want to carry out, you know. So if you are finding it difficult with a certain procedure, you can check the hospital manuals to find out about it. Or maybe you don't understand a particular medication, or maybe the dose, you want to find out about the dosage, you can easily just check the where maybe they put medication chart information, and then be able to look for the information you are looking for. So that's about that. Now, report client condition by law. We talk about that already. Scope of practice. You need to know your scope of practice, not only for yourself, but for other members as well too. And the mistake a lot of students used to do on the NCLEX exam is that they feel every information on the NCLEX exam is for them. When the NCLEX is talking about surgery, the surgery is not for you. The only thing that the NCLEX is testing you is pre-op, post-op, and monitoring for complication, right? So the surgery is for the doctor. You need to know your scope of practice so that you don't start thinking what you should not be thinking about. That is about scope of practice. Now, participating in performance improvement projects, quality improvement process. Yeah, there are a lot of them on the NCLEX exam. Staff teaching, staff education. That is performance improvement project, whereby you learn about a new thing. It might be infection control. It might be anything, maybe about treatment of a certain patient, different condition. It's just a form of teaching, right? And there's a teaching concept that you need to know. Teaching concept you need to know so that you can be able to navigate your answer. So it's two ways. If you know about the teaching, you can be able to answer the question. And if you don't know about the teaching, you can also utilize the concept as well to be able to answer the question. But question that you are going to see in this area are staff education question, whereby they say you attended a staff education about so and so. What, or maybe you're about to teach, maybe it can either be you are teaching other staff members as well too. You're about to prepare a staff teaching about so and so. What would you include in the teaching? Or you attended a teaching staff education about so, what will show correct understanding? That's what the NCLEX is. So this is the end of the review session. Any question?
Oh, this session was great.
All right, I'm glad to hear that. All right.